Welcome to Practical Cardiology Pearls, where complex cardiology is simplified.
In this video, we will review the new updates in the 2026 ACC/AHA Dyslipidemia Guideline. The first major update is that LDL targets are back. If the patient is in the intermediate risk group, the treatment goal is to reduce LDL below 100. If the patient is in the high-risk group, the goal is to reduce LDL below 70. If the patient is in the very high-risk group, the target is LDL below 55. The second major update is the introduction of the PREVENT score. Patient information is entered into the calculator, which then estimates the patient's 10-year and 30-year cardiovascular risk. The next major update is that Lp(a) is now recognized as a major cardiovascular risk factor. The guideline recommends measuring Lp(a) at least once in all adults. An Lp(a) level above 125 is considered a meaningful risk, while a level above 250 is considered a very high-risk phenotype. The next update is that measuring ApoB and non-HDL-C has become more important. It is no longer just about LDL. ApoB and non-HDL cholesterol are now also used in clinical decision-making. This is especially important in patients with diabetes, metabolic syndrome, high triglyceride levels. The next update is that the role of coronary artery calcium, CAC, scoring has become even more important. This is especially useful in patients with borderline risk, younger patients, and patients when there is uncertainty about starting a statin. After calculating the CAC score, the clinical decision is reassessed. The next update is earlier and more aggressive lipid management. Even if a patient's 10-year cardiovascular risk is low, lipid management should be started at an earlier age to help prevent subclinical atherosclerosis. The next update is that new lipid-lowering therapies have now been incorporated into the guideline. Drugs such as Inclisiran, evolocumab, alirocumab, Bempedoic Acid have now been integrated into practical treatment algorithms for lipid management. In this video, we reviewed the following key updates from the 2026 AHA/ACC Dyslipidemia Guideline. 1. LDL targets were lowered. 2. The PREVENT risk calculator was introduced. 3. Lp(a) gained greater importance as an independent cardiovascular risk factor. 4. Measuring ApoB and non-HDL-C became more important in clinical decision-making. 5. Coronary artery calcium, CAC, scoring gained a larger role in risk assessment. 6. Earlier and more aggressive lipid management was recommended. 7. New lipid-lowering therapies were incorporated into the guideline algorithms.
Thank you for watching. You can write the topic title in the comments that you want to learn with simplified explanations.